Diabetes, symptoms, causes, prevention, and treatment. Diabetes is a condition that causes a person's blood sugar level to become too high. Diabetes occurs when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Insulin is a hormone that regulates blood glucose or sugar. The hormone insulin moves sugar from the blood into your cells to be stored or used for energy. If this malfunctions, you may have diabetes. Glucose is an important source of energy for the cells that makes up the muscles and tissues. It's also the brain's main source of fuel. Raised blood glucose or raised blood sugar, known as hyperglycemia, is a common effect of uncontrolled diabetes and over time leads to serious damage to many of the body's systems, especially the nerves and blood vessels. Untreated high blood sugar from diabetes can damage your nerves, eyes, kidneys, and other organs. But educating yourself about diabetes and taking steps to prevent or manage it can help you protect your health. Types of diabetes. There are a few different types of diabetes. This includes type 1. Type 1 diabetes is an autoimmune disease. The immune system attacks and destroys cells in the pancreas where insulin is made. It's unclear what causes this attack. Type 2. Type 2 diabetes occurs when your body becomes resistant to insulin and sugar builds up in your blood. It's the most common type. About 90 to 95% of people living with diabetes have type 2. Type 1.5. Type 1.5 diabetes is also known as latent autoimmune diabetes in adults, LADA or LADA. It occurs during adulthood and sets in gradually like type 2 diabetes. Latent autoimmune diabetes in adults or LADA is an autoimmune disease that cannot be treated by diet or lifestyle. Gestational diabetes is high blood sugar during pregnancy. Insulin-blocking hormones produced by the placenta cause this type of diabetes. A rare condition called diabetes insipidus is not related to diabetes mellitus. Although it has similar name, it's a different condition in which your kidneys remove too much fluid from your body. Diabetes mellitus refers to a group of diseases that affect how the body uses blood sugar or glucose. Each type of diabetes has unique symptoms, causes, and treatment. Prediabetes. Prediabetes is the term that is used when your blood sugar is higher than expected, but it's not high enough for diagnosis as type 2 diabetes. It occurs when the cells in your body don't respond to insulin the way they should. This can lead to type 2 diabetes down the road. Experts suggest that over 80% of people with prediabetes don't even know it. General symptoms of diabetes. Diabetes symptoms are caused by rising blood sugar. People who have type 1 diabetes may have nausea, vomiting, or stomach pains. Type 1 diabetes can be diagnosed at any age, and symptoms can develop in just a few weeks or months and can be severe. Latent autoimmune diabetes in adults seem to straddle type 1 and type 2 diabetes. Bits of it are more like type 1 and other bits are more like type 2. Hence, it's called type 1.5 diabetes. It's not actually classified as a separate type of diabetes at the moment, but there are some medical research going on to try and pinpoint exactly what makes it different from type 1 and type 2 diabetes. In type 2 diabetes, the symptoms can be mild and may take several years to develop. Some people don't notice any symptoms at all. Type 2 diabetes usually starts when you are an adult, though more and more children and teens are developing it. Because symptoms are hard to spot, it's important to know the risk factor for type 2 diabetes. Tingling nerves and slow healing sores are more common in type 2. Left untreated, type 1 in particular can lead to diabetic ketoacidosis. This is when there is a dangerous level of ketones in the body. It's less common in other types of diabetes, but it's still possible. The general symptoms of diabetes include increased hunger, increased thirst, frequent urination often at night, blurry vision, extreme fatigue, lose weight without trying, have numb or tingling hands or feet, have very dry skin, have sores that heal slowly, have more infections than usual. Specific symptoms in men. In addition to the general symptoms of diabetes, men with diabetes may have a decreased sex drive, erectile dysfunction, poor muscle strength. Specific symptoms in women. Women with diabetes can have symptoms such as vaginal dryness, urinary tract infections, yeast infections, dry, itchy skin. Gestational diabetes. Most people who develop gestational diabetes don't have any symptoms. Healthcare professionals often detect the condition during a routine blood sugar test or oral glucose tolerance test, which is usually performed between the 24th and the 28th weeks of pregnancy. In rare cases, a person with gestational diabetes will also experience increased thirst or urination. People with diabetes have a higher risk of health problems, including heart attack, stroke, and kidney failure. Diabetes can cause permanent vision loss by damaging blood vessels in the eyes. Many people with diabetes develop problems with their feet from nerve damage and poor blood flow. This can cause foot ulcers and may lead to amputation. The causes of diabetes. Different causes are associated with each type of diabetes. Type 1 diabetes. Doctors don't know exactly what causes type 1 diabetes. For some reason, the immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. Genes may play a role in some people. It's also possible that a virus sets off an immune system attack. Type 2 diabetes. Type 2 diabetes stems from a combination of genetics and lifestyle factors. Having overweight or obesity increases your risk too. Carrying extra weight, especially in your belly, makes your cells more resistant to the effect of insulin on your blood sugar. This condition runs in families. Many members share genes that make them more likely to get type 2 diabetes and to be overweight. Type 1.5 diabetes. Type 1.5 is an autoimmune condition that occurs when the pancreas is attacked by your own antibodies. Similar to type 1, it may be genetic, but more research is needed. Gestational diabetes. This occurs as a result of hormonal changes during pregnancy. The placenta produces hormones that makes a pregnant person's cells less sensitive to the effect of insulin. This can cause high blood sugar during pregnancy. People who are overweight when they get pregnant or who gain too much weight during pregnancy are more likely to get gestational diabetes. Both genes and environmental factors play a role in triggering diabetes. Risk factors for diabetes. Certain factors increase your risk for developing diabetes. Type 1 diabetes. You are more likely to get type 1 diabetes if you are a child or teenager, you have a parent or sibling with the condition, or you carry certain genes that are linked to the disease. Type 2 diabetes. Your risk for developing type 2 diabetes increases if you are overweight, age 45 or older, have a parent or sibling with the condition, are not physically active, have had gestational diabetes, have prediabetes, if you have had high blood pressure, high cholesterol, or high triglycerides. Type 2 diabetes also disproportionately affects certain racial or ethnic populations. Adults who are African American, Hispanic, Latin American, or Asian American ancestry may be more likely to be diagnosed with type 2 diabetes, according to a 2016 research. Type 1.5 diabetes. Type 1.5 diabetes is found in adults over 30 and is often mistaken for type 2, but people with this condition are not necessarily overweight, and oral medications and lifestyle changes have no effect. Gestational diabetes. Your risk for gestational diabetes increases if you are overweight, over age of 25, have had gestational diabetes during a past pregnancy, have given birth to a baby weighing more than 9 pounds, have a family history of type 2 diabetes, have polycystic ovary syndrome, PCOS, environment, and pre-existing medical conditions can all affect your odds of developing diabetes. Find out which risk factor you can control and which one you can't. Diabetes complications. High blood sugar damages organ and tissue throughout your body. The higher your blood sugar is and the longer you live with it, the greater your risk of complications. Complications associated with diabetes include heart disease, heart attack, stroke, neuropathy, nephropathy, retinopathy and vision loss, hearing loss, foot damage such as infections and sores that won't heal, skin conditions such as bacteria and fungal infections, depression, dementia, gestational diabetes. Unmanaged gestational diabetes can lead to problems that affect both the mother and the baby. Complications affecting the baby can include premature birth, higher than typical weight at birth, increased risk for type 2 diabetes later in life, low blood sugar, jaundice, stillbirth. A pregnant person with gestational diabetes can develop complications such as high blood pressure, preeclampsia, or type 2 diabetes. You may also require cesarean delivery, commonly referred to as a C-section. The risk of gestational diabetes in future pregnancies also increases. Diabetes can lead to serious medical complications, but you can manage the condition with medications and lifestyle changes. Diabetes prevention. Type 1 and type 1.5 diabetes are not preventable because they are caused by an issue with the immune system. Some causes of type 2 diabetes, such as your genes or age, are not under your control either. However, many other diabetes risk factors are manageable. Most diabetes prevention strategies involve making simple adjustments to your diet or fitness routine. Lifestyle changes are the best way to prevent or delay the onset of type 2 diabetes. If you have received a diagnosis of prediabetes, here are a few things you can do to delay or prevent type 2 diabetes. Reach and keep a healthy body weight. Get at least 30 minutes each day or 150 minutes per week of aerobic exercises like walking or cycling. Cut saturated or trans fats along with refined carbohydrates out of your diet. Eat more fruits, vegetables, and whole grains. Eat smaller portions. Avoid smoking tobacco. Choose drinks with no added sugar. Reduce your intake of red and processed meats. Having red and more processed meats like bacon, ham, sausage, pork, and lamb are all associated with an increased risk of type 2 diabetes. Try to get your protein from healthier foods like pulses such as beans and lentils, eggs, fish, chicken, turkey, unsalted nuts. Fish is really good for us, and oily fish like salmon and mackerel are rich in omega-3 oil, which helps protect your heart. Reduce your alcohol intake. Drinking too much alcohol is linked to increased risk of type 2 diabetes. Try to lose 5% to 7% of your body weight if you have overweight or obesity. Treatment of diabetes. Doctors treat diabetes with a few different medications. Some are taken by mouth, while others are available as injections. Type 1 and 1.5 diabetes. Insulin is the main treatment for type 1 and 1.5 diabetes. It replaces the hormone your body is not able to produce. Various types of insulin are commonly used by people with type 1 and 1.5 diabetes. They differ in how quickly they start to work and how long their effects last. Rapid-acting insulin starts to work within 15 minutes and its effects last for 2 to 4 hours. Short-acting insulin starts to work within 30 minutes and lasts 3 to 6 hours. Intermediate-acting insulin starts to work within 2 to 4 hours and lasts 12 to 18 hours. Long-acting insulin starts to work 2 hours after injection and lasts up to 24 hours. Extra long-acting insulin starts to work 6 hours after injection and lasts 36 hours or more. Premixed insulin starts to work within 15 to 30 minutes, depending on whether a rapid-acting or short-acting insulin is part of the mix, and lasts 10 to 16 hours. Type 2 diabetes. Diet and exercise can help some people manage type 2 diabetes. If lifestyle changes are not enough to lower your blood sugar, you will need to take medication. Diabetes in pregnancy. People who have never had diabetes can suddenly develop gestational diabetes during pregnancy. Hormone produced by the placenta can make your body more resistant to the effect of insulin. Pregestational diabetes. People can have diabetes before they conceive and carry it with them into pregnancy. This is called pregestational diabetes. Risks to your newborn. Diabetes during pregnancy can lead to complications for your newborn, such as jaundice or breathing problem. If you are diagnosed with pregestational or gestational diabetes, you will need special monitoring to prevent complications. Will gestational diabetes disappear on its own? Gestational diabetes should go away after you deliver, but it significantly increases your risk of getting diabetes later. About half of people with gestational diabetes will go on to develop type 2 diabetes. Diabetes in children. Children can get both type 1 and type 2 diabetes. Managing blood sugar is especially important in young people because diabetes can damage important organs such as the heart and kidneys. Type 1 diabetes. This autoimmune form of diabetes often starts in childhood. One of the main symptoms is increased urination. Kids with type 1 diabetes may start wetting the bed after they have been toilet trained. Extreme tests, fatigue, and hunger are also signs of the condition. It's important that children with type 1 diabetes get treatment right away. The condition can cause high blood sugar, dehydration, and diabetic ketoacidosis, DKA, which can be medical emergencies. Type 2 diabetes. Type 1 diabetes used to be called juvenile diabetes because type 2 diabetes was so rare in children. Now that more children have overweight and obesity, type 2 diabetes is becoming more common in this age group. Some children living with type 2 diabetes don't experience any symptoms. Others may experience increased tests, frequent urination, extreme fatigue, blurry vision. Type 2 diabetes is often diagnosed based on medical history, a physical exam, and blood work. Untreated type 2 diabetes can cause lifelong complications, including heart disease, kidney disease, and blindness. Healthy eating and exercise can help your child manage their blood sugar and prevent these problems. Type 2 diabetes is more prevalent than ever in young people. Learn how to spot the signs so you can report them to your child's doctor. Conclusion: some types of diabetes like type 1 and 1.5 are caused by factors that are out of your control. Others like type 2 can be prevented by better food choices, increasing activity, and losing weight. Discuss any potential diabetic risks with your doctor. If you are are at risk, have your blood sugar tested and follow your doctor's advice for managing your blood sugar. Hi, thanks for watching to the end. I hope this video has been informative and helpful. If you like this video and you would like to see more contents like this, kindly like, share, leave a comment in the comment section. And also please subscribe to this channel if you have not already subscribed yet. Thanks for watching to the end. Have a nice day and look out for the next video.